Hi there, I'm Dre, the host and founder of the Dragon Network, an online membership-based community where health IT professionals can share ideas, discuss experiences, and collaborate with one another on all things related to health IT. This week's video is going to be a follow-up to last week's and a follow-up to the last video of the year that I did in 2020, and we are going to talk about what my 5 health IT predictions are for 2022. And these predictions are focused on where I think that health IT staff members, whether you work for an organization or for a vendor or are independent, are going to be focusing their work efforts over the course of 2022. As with the last set of videos, I will 12 months from now look back and see how I did with the predictions and talk about whether I was on the mark or completely off track with everything. Before I get started, if you haven't had a chance to subscribe to the channel yet, please go ahead and do that now. And as always, if you like the types of videos that I've been posting on this channel, hit that like button so that I know and then I can gauge what types of videos you guys want to see in the future. So the first area that I think health IT professionals will spend time focusing on in 2022 is with healthcare staffing. So there's a few different aspects to this staffing that I think will be important. I think we're going to have to focus on functionality within some of our ERP systems or some of our specialty systems that deal with staffing, on tracking staff competencies so that we have the ability, if necessary, to quickly shift areas between staff members. So if we take clinical staff, for example, in the nursing profession, there are certain competencies that you would need to maintain to be able to care for patients in the intensive care units, in the emergency departments, in labor and delivery, and a variety of different areas. Keeping track of those competencies on who has the right levels and who has the knowledge and skills to assist in what areas, I think is something that we'll need. We have started doing a little bit of that now because we are forced to, just with the general nature of what's happening in healthcare and the pressures that we're facing. But I think keeping track of that a little bit better is something that we're going to look at, and it's something that we're going to maintain going forward. Same thing goes for some of our administrative staff, sort of understanding what systems they're familiar with, understanding if they can flex to different areas. So really understanding who our staff are, where they're at, and how we can leverage them best for our organizations to respond to pressures that we may face is one of the areas. The second area that I think we're going to need to deal with in this particular topic is recruitment and retention. So we've all been hearing a lot about everyone sort of quitting their jobs and moving on to better things. I don't know that that's necessarily entirely the case. However, we are seeing a lot of early retirements. We're certainly seeing some staff burnouts, and we're seeing a lot of movement in the healthcare industry between organizations. So we've seen some staff nurses, for example, resign and switch to travel nursing just because of the pay differences. We've also started to see some of our IT support staff look for opportunities that allow for full-time remote work that may be in a different state or a different province. So I think those shifts as we come out of a pressure type situation with the pandemic are going to actually continue. And I think the recruitment and retention efforts in the IT world is something that we're going to have to look at. And tied to that retention and hiring, I think we're going to have some continued focus and some back and forth within each health organization or within each entity on what it really looks like to have that remote and in-office work balance for IT staff in particular. So we do know that a lot of our activities and a lot of our work can be done on a computer, and we've proven that that computer can go anywhere, sort of similar to this laptop. However, there's a lot of things in the health IT space that actually do require interaction with staff, with clinical staff for workflow analysis and for troubleshooting and things like that. So I think it's going to be a big focus of 2022 and this whole staffing topic to figure out where that work and remote balance lies so that you can efficiently work within the organization and that we have an optimal balance between the two. The second one that I think we're going to focus on is the ingestion of data from consumer-based apps. So this is a carryover from my 2021 prediction, which didn't exactly pan out as I thought. However, I do think now that we have more of the general population actually tracking things that are related to health, so things, of course, like sleep and fitness and O2 levels, that kind of stuff, I think we're going to start to see some movement in trying to incorporate that data into the records. So right now it's sitting off in the general tech industry, and there are some organizations that are leveraging the data, but it's not being leveraged widespread. I think 2022 will really start to see some movement in leveraging that data, and I think we're going to see some pretty interesting sort of transformations that happen and some great use cases that we can look to see how that's actually going to help going forward. The next thing that I think we will spend a lot of time working on and talking about and considering is cybersecurity. So over the last 2 years, and in 2021 in particular, we unfortunately saw a huge number of cyber attacks in the health sector. There were some significant impacts to organizations that resulted in EHRs being down for days or weeks at a time. We had some financial hits, we had some data breaches, we had all sorts of things related to cybersecurity. I think it's going to be a huge topic of conversation, and there's going to be a lot of movement in this area trying to secure the environments and assets. So there's two different areas that I think we're going to focus on. One is securing that infrastructure, so making sure that there are projects underway that sort of shift us towards those zero trust strategies, and I'll put a link to a video on zero trust below if you're not sure what that term means. So zero trust strategies, I think there's just, a lot of focus on activity around the infrastructure. And I also think there's a lot of education that's going to happen around making sure that wherever possible, we don't introduce bad actors into our systems. Unfortunately, they're brought in more often than not through unwilling participants who click on a phishing email or something like that. So I think there's going to be a lot of focus on trying to educate different people in the health sector on what to avoid, what to watch for, to try to make sure that that doesn't happen. And I also think we're going to focus on our downtime procedures. So we learned some pretty big lessons from the Scripps Health outage, from the UHS outage, from the Newfoundland and Labrador Health outage. There was another one in Oregon, and those resulted in impacts to systems that lasted weeks. So we have downtime procedures that are focused on short downtime events. So if our EHR goes down for 4 hours, 6 hours, even for 12 hours, we have a great plan in place. But we saw with some of these events and some of the lessons learned discussions that happened after, we saw that if your EHR and your network and your systems and your communication is down for several days or multiple weeks, those downtime procedures, they become a whole different ballgame. So there is a very different focus that needs to happen on figuring out how to navigate through an extended outage. And a lot of reaction had to happen to sort of deal with that, because most of the downtime procedures were focused on shorter intervals. So I do think as part of the cybersecurity conversations, just in general operational readiness, I think there's going to be conversations and some activity around how do we figure out what we're going to do if it happens to us or when it happens to us, and what does an extended outage of IT systems actually look like, both from the clinical systems perspective and from the administrative or business systems perspective. Next up, I think we're going to need to have some focus on the backlogs for elective procedures and surgeries. And this one in particular is going to affect Canada, where we have universal healthcare and everything sort of funnels through the same organization. I don't think that the US or other markets are going to avoid these conversations. I just think depending on the structure of your healthcare system, this may be more impactful in your particular country or area than it is for others. But throughout the course of the last 2 years, really, we've had several periods of time where, due to pressures that are on the healthcare system and the availability of ICU beds for the purpose of recovery, we have had to limit, cancel, or restrict elective procedures, which of course includes some surgeries. So I think that how we manage that waitlisting, how we look at the prioritization, how we increase capacity for our procedure spaces and our ORs, I think that's going to be something that we're really looking at. We're going to be going for high efficiency. We need to clear those backlogs as quickly as possible. We're not necessarily out of them yet. So I do think that 2022 is going to have a pretty big focus on making sure that we have optimized the flow of elective procedures as much as we possibly can, so that we don't have any waste in our system with respect to time and throughput. So that is something, again, that I think is going to vary by jurisdiction, but I do think that there's going to need to be quite a bit of focus, and I think they're going to look to IT to sort of help understand some of the metrics, to understand where some of the gaps may be, and to assist them with optimizing those workflows and optimizing that procedure in OR space and staffing around those areas. Last but certainly not least, and probably one of the most important predictions that I have on my list, is I think we are going to spend a lot of time in healthcare IT looking at ways to incorporate mental health type aspects, whether that be intake or treatment or tracking over time, into our general workflows. So we have started to really understand the impact of mental health on physical health, and it is just not possible to keep those two separated. They've been separated for far too long in far too many jurisdictions, and we need to start treating the entire person. I think from a health IT perspective, most organizations already have some of this in place. I think there's going to be more focus on actually incorporating this into our IT worlds. So whether it be updates to some of our clinical notes, incorporation of other data, all things around mental health as that data is incorporated into the whole chart, and as we look to things like that. I think as privacy legislation gets updated in various jurisdictions, it's also going to be taking a closer look at mental health data. So incorporating some of those things if we do see changes in the rules. And I do think it's super important that we understand sort of how to integrate that into the whole person care model and into the patient-centric care that we're looking for. So those are the 5 areas that I think we're going to spend the most time on health IT related activities, tasks, and projects in 2022. I have no idea if I'm going to be right with those 5 areas or if something else is going to come out of the woodwork and divert our attention for a big chunk of the year, but we will take a look at this again in 12 months and see how we did. I wish everyone a happy new year if you're watching this before the end of 2021, and if we've already crossed that date when you're watching this, have a great rest of your day. I will talk to you again soon.